Embracing electronic health records is just another way that Tallahassee Memorial Healthcare is on the cutting edge of new technologies and embracing those things for the public, just as we have iPads and top-of-the-line computers at home and technology has reached other fields. It's finally come to medicine, and TMH is embracing that and on the front line of pulling that into taking care of their patients.
PowerNotes provide a lot of flexibility and efficiency to the user and a tremendous amount of communication to all of the people trying to care for the patient, from other physicians to nursing, to everybody involved in patient care. They can see and get a better picture of what's going on with the patient by having the notes available at the time that the physicians create them and not having to wait for the notes to be put in the system after they're dictated.
Hopefully with PowerNote you will see more physicians being able to find things faster in the record because they can review the last note, which tends to be comprehensive. It has the most up-to-date vital signs, everything you might need in it. And having the computerized chart means that you can find records faster. And the search features built into the electronic record mean you don't have to flip through all the paper to find what you need to review things for the record when you go to see the patient. And hopefully we know more about what's going on before we walk in the room. I feel like the other team members, nutrition, physical therapy, the nurses even are able to know what's going on with the patient and know what we're thinking about the patient because it's legible, it's thorough, and it's kept up to date. And so anyone from anywhere can pull up that record who has access to that chart. So if I'm on the other side of the hospital and I need to review the chart, it's right there. I can just pull it up on any computer. If I'm the physician at home and I need to review notes that other clinicians have put in, the specialist, anyone else, I can pull those up. I don't have to be at the chart at the bedside looking at the paper chart or having someone else read it to me and worry about misinterpretation. I feel like with our physician liaisons, we've done a very good job of building up the training program for PowerNote. We're actually looking at building up PowerNote classes with beginner, moderate, and advanced levels so we can continue to train. It's not a one-time training process, but you build that groundwork and you go back and you retrain and kind of address specific problems as they come up. But those physicians who have undergone training initially seemed concerned about how things would go with it. But afterwards, many of them said, "Oh, I'm not sure what I was so worried about. This seems to have gotten much easier with practice." And the ones who use it start using it very quickly, and their numbers go up fast, and then they don't go back to paper at all.
What I've noticed with training users on PowerNote is that it involves an initial time period to get used to the note and to realize all the functionality that's possible. And then after that, providers are usually really excited and happy with how the notes look and get lots of ideas and really after that go forward with it on their own with a lot of success.
When entering the process of using PowerNote, the first thing that I would do would be have a brief meeting with the physician liaisons because they've been very helpful, especially when I've had some issues, minor issues here and there or questions. I've called the liaisons and they've been able to clear things up very quickly. They're very accessible, so the problem can be taken care of really quickly instead of going through a long process and not knowing the answer. So I would just call them, and they've been a great help.
We want to help each physician make the notes their own. We want to convey the voice of each physician and help them tell the story in their own words about the patient experience. So building the note process, we can help them put in their standard physical exam and their review of systems and kind of customize the notes out to the way that they practice. So we hope to not change the way they practice, but just augment that and help with the notes.
Part of what I like about PowerNote and working with physicians in PowerNote is that they usually really like PowerNote and like all of the features that it provides to them. Usually I hear phrases like, "This is so much easier than I thought," or "This is great," or "Wow, that's really going to be a time saver." These are some of the, this is some of the feedback that I hear from providers is how easy it is, how easy it is to use, how easy it is to perform certain functions, some of the copy features, some of the macros that they can use.
In the end, the goal of all of this is to focus on how this helps the patient out. With better documentation, we can better track things, we can follow through on the records, we can flag records as we need to, and hopefully we can build in clinical decision support to help physicians and guide the process with getting the patient through their hospitalization. More accessible records, more communication that can only help patient care in the long run.